Hello, everybody. Greetings from Singapore. Thank you very much for inviting me to this. My name is Agnieszka Olszewska-Guizzo. I'm a PhD in landscape architecture and urban ecology, and I work a lot with neuroscience. I'm a president and founder of Neuro Landscape Foundation, and I currently work as a researcher at National University of Singapore in the iHealth Tech Institute. Today, I will present some new findings, some new insights about the green and healthy cities and how we can connect the approach of environmental exposures throughout the life with the healthy aging approach. So to start with, I want to emphasize that aging affects all stages of life, not only the late adulthood. When we think about the mental health and aging, we usually instinctively think about the elderly person with dementia, including Alzheimer. For these, however, the treatments are to date not available. We can only prevent or delay these issues to happen or mitigate the symptoms. Also, there is a lot of different mental illnesses affecting different stages of the life. And today, research shows these issues are very much related to dementia due to just some neural mechanisms. Depression in earlier life will increase by 2 times or more the dementia. That's just one example. How does the environment come into this whole equation? So according to the socio-ecological model of health, the living environment and environmental factors influence the overall mental health and well-being of people. Here, urbanization is a risk factor for psychiatric disorders, already demonstrated through meta-analysis. There is around 39% prevalence of mental health disorders in the urban populations as compared to the rural population, for instance. So urbanization is contributing significantly to the growing burden of mental health disease. On the other hand, we have a lot of urban greening, nature-based solution practices to improve the living environments and those environmental determinants that can determine, improve or decrease our mental health as we live in the cities. A lot of research is being conducted in that area, and new concepts are emerging, such as neurourbanism, environmental neuroscience, and they are also basis of the organizations, such as my organization called Neuro Landscape. What actually are the urban green and blue spaces? We all know them. They are scattered, there are green spaces scattered around the cities, more or less connected with each other. We have a lot of them, but they were not particularly designed to serve mental health and well-being. They definitely weren't designed to in the service of healthy aging, but they can be used in service of healthy aging if we kind of boost their potential and introduce new solutions, new approaches to looking at them. First of all, as mentioned before, the aging starts actually at the prenatal phase, and this is where our mental health issues also start. As research shows from the new evidence at the GASTO group, that is one of the most recognized cohort studies in Singapore, the poor mental health in mothers affects negatively the neurodevelopment of babies, and it already starts at the pregnancy stage. Pregnant women, however, are one of these groups. They cannot receive the medication for mental disorders. Actually, if they were on medication before pregnancy, they are advised to stop taking it. So they are one of these vulnerable groups that really needs the non-pharmacological approaches. Also, they need the self-care approaches, very safe, very accessible. And with the NPARCS team and the GASTO teams in Singapore, we just conceptualized and started the Peacetime project, promoting exposure to green spaces to improve mental health, which is the first of that scale clinical trial to test the intervention on pregnant women. The intervention that will include regular walks in the selected parks. Not every park, but only those characterized by high contemplative features will be recommended. And as an outcome of this study, we will have hopefully the very cheap and effective intervention for prenatal mental health, also promoting the parks and urban green spaces and their healthy spots to a general population, it can have a really huge public health benefit. There is another study we are conducting here in Singapore called Effects of Landscapes on the Brain. In that study, we are testing different qualities of the landscapes scenes called contemplative landscape features. We have found through the preliminary results that these particular landscape exposures induce in the brain of healthy individuals a pattern of brain activity associated with positive emotions, motivation, and approach. The busy urban spaces that was serving as a control in our experiment induced the opposite pattern that is usually found in patients with depression. We are still working on the group of patients, but from that study, we can already see that it is really the quality of the urban exposures that is affecting, triggering the positive or negative brain responses that can affect different mental health problems. Our contemporary cities were mostly designed in the times of the Industrial Revolution, and they were designed to mainly serve the industry, having the large numbers of workers accommodated in residential zones and conveniently connected to factories and workplaces. At that time, nobody really thought about the mental health outcomes of such design. Nobody really thought about the healthy aging in such places. But today we already know that our cities are not mentally healthy places, mainly due to the overstimulation, overload of information, and the pattern of attention that we have every day in our city life is mostly so-called goal-oriented attention. On the other hand, the nature provides attention called stimuli-driven attention or involuntary attention, providing us with this mechanism of restoration of our attention. That's why going outside to nature after a stressful day at work gives us this stress reduction, attention restoration, and the reorientation within completely different order. At the end, I would like to mention the elderly people and what we know about their mental well-being in regard to nature connectedness. The research shows so far that the exposure to nature through just a passive exposure, passive recreation, sedentary activities in the park, walking, observing, contemplating the nature, can have huge benefits for elderly in lowering the risk of cardiovascular disease, also slower cognitive decline and stress reduction. And the activities, more organized, more structured, such as horticultural therapy, can affect and decreased inflammation, which is huge for delaying of dementia and combating dementia in a way, and to the social connectedness. But what if the nature is just simply not there, or not accessible, or someone is sick or bedridden, or it's very cold outside, or we just simply don't have time to go for our regular visits in the quality nature? Then the technology can come in handy. The VR technology, as an example, provides a strong immersive experience, working as a distraction mechanism from pain, boredom, sadness, and so on. And here we hypothesize that the mental health benefits from contact with the real nature can potentially be comparable with benefits of the contact with simulated nature. And here our research and also teams from around the world is ongoing, and new tools are developed and tested in different issues and different pathologies. So, to conclude, today we have already enough evidence of the key role of the quality of the living environments and exposure to different environments for the healthy aging. Urban spaces need to promote their mental health from the earliest stages of life, using scientific evidence to inform that design. Also with the consideration to the quality of the spaces, not just simply quantity when designing the urban green spaces. Such quality can be achieved with accessible existing tools like, for example, contemplative landscape model with contemplative landscape features, and also the new technologies incorporating VR, AR can be very useful to facilitate that everyday exposure to healthy environments. So with that, I want to end my presentation. Thank you very much for your attention. Please feel free to ask me any questions in the Q&A session or just send me an email. Thank you very much.